So I'm facing this way, and I'm going to twist on, and my body's going to face that way, and get that elbow out. So my fingers are going to be like that. It's similar to the roll, you're just doing a little bit more. You get the leverage. So get tall first, find that contact, and that's my setup right there. Okay? Yeah. Yeah. So you figure out where you want to take the contact on the shoulder and the front of the chest sometimes. That's my joint play. I can feel where that restriction is coming. So breath in and out. That was a table. It wasn't me. No credit to me or him. It's the table. Sometimes the table goes, makes you look good, but it wasn't me. The joints aren't that loud. In the head, when you get a cavitation up here, it sounds that loud, but it's not. It wasn't me. I don't think it went. I don't know if it did. That's just to show you. Okay. So again, you're doing this, you're pushing and finishing with an impulse, with a body drop at the same time. Line of drives like that, following the femur. So it's all about leverage, doctor positioning. You don't want him falling to the floor and you haven't even stretched him yet. You're fighting to keep him on the table. Right? And you have to be close because you don't want that momentum to carry over. He goes on the floor. Okay? Any questions on that?
So the lumbar roll,
yeah,
compared to this, the difference, really two differences. Your pisiform on the superior SI will be on the PSIS,
yes,
and the leg stays at 90.
yeah.
You don't move the leg.
Yeah, you're not searching how much lumbar curvature you want to change.
Right?
You're not looking for that. You're just putting it at 90.
For the superior
That's your
SI,
lever.
the pisiform will be on the PSIS and the leg's at 90.
Yeah.
And you're doing the specific one, the other one, for the lumbar, you're moving the leg till you
to figure out how much hip flexion you
move. That's where the leg will be, but not for the SI.
And you have more upper
SI,
body
right
counter
at 90.
rotation.
Okay, perpendicular, because you're shooting right down that leg. That's your line of drive, right down the leg.
Okay.
Got
That's
it.
the only difference.
Got it.
Last one, lower SI. I'm not going to show you the variations. It depends on the TAs. On Friday, the TAs show different variations. There are 2 or 3 ways of doing all of these. Stick with one. Lumbar roll looks after 2 body parts, in a sense. Again, for SI, I don't want T-spine to be like this. I don't want the scapula on the table. It's more neutral to start with. So assume the shoulder on shoulder, hip on hip. Your side line. That's your starting position for lumbar and SIs. You just have to figure out how much of this you want for type 2. You palpate, you pull, there it is. Hold them, that's my starting point. And then do you need a negative on the pelvis, or roll? Is he hip on hip? That's a good starting point for either one, really. Type 2, you might have a little bit more of this. SI is more neutral, 90. You're concentrating on the pelvis coming strongly towards the doctor. Push, push, push. Lower SI, how are your hamstrings doing?
Okay.
For a big guy who looks muscular, he's surprisingly flexible, I find. Some people, they look like they're going to be stiff. He's not. I don't know if he's practicing what we preach around here, but there's a couple of ways of doing this. I like this one for the lower SI. And again, shoulder on shoulder more. Headrest is up. If you can do this, I like this because it really brings the pelvis where I want it. The motion palpation, where you're not responsible for it, but that tuberosity should have gone anterior and up. It's not, so I'm going to take the ischial tuberosity and help it go up towards his nose. And some people will take the contact like this. But I like getting a little bit more set up here. If you can have a wide stance, the key is not to let rotation happen on the lumbar spine, so don't let him fall down like this. You got to be wide enough to keep him level. I'm going to catch him. I'm not going to do the accordion and do this with both hands. I'm just catching him so all this weight doesn't end up on the shoulder of the table, headrest, and the table goes like this. I want to keep him from going off the table. That's my contact. This is my compression here. Compress and then thrust. You can push off this foot. You can lunge. The key is not to rise up. That line drives off. I'm on the outside of the tuberosity. I'm pushing soft tissue that can hurt. There's nerves here. I want to stay here. So don't rise up ahead of your thrust. Stay here. Compress, right? Compress and thrust.
Your chest is behind your front.
Yeah, you gotta stay here. And sometimes it's hard on your ribs. If you have rib problems, you might feel it that day. Because I'm back here, I'm going with my contact. I'm not going in advance of my contact and then thrusting. It's like a lunge, push.
So that was inferior.
Yeah, that's my lower SI.
Okay.
And the body's straight.
Yeah. So he's neutral, lots of hip flexion. The nominative wants to go with it. I'm gonna help it. So make sure you got the good contact.
Is your thrust coming from your arm or from just from the
Bicep pec. Push, but the body's doing a lot of it. I'm shifting, I'm leaning to help do the work. Push.
You need a lot of force to get this one
I don't get cavitation, but you'll see the motion palpation improves. It's done. We're done.
Can you actually just go over how the body position? Because you're saying that the body.
With this one, lower SI?
No, that one was straight up, like
Yeah.
it was straight. But I got confused in the superior, how the body should be.
Superior, it's 90 degrees hip flexion.
Okay.
More neutral positioning. Bottom shoulder always comes out as a wedge, so grab me. If he's balancing around on the roundness of his deltoid, bring that forward a bit.
Oh, okay.
But it's still more neutral compared to a type 2, you'll be more like that. Right?
Got it.
More like this and like more like that. So more, you're centering the force here, but you're doing a lot of counter rotation up here, a lot of rotation here, and that segment's coming with that pelvis towards the doctor. Here it's more neutral, yeah? And neutral to start with. Get him stretched out a bit. So it's easier to take that contact. And then you would finish with a thrust that way, following the femur. Whereas type 2, where do I want that hip? SP start moving there, that's where I commit. You get hook on now, and do this. A lot more stretching. Huh?
Got it.
And then finish. Thank you.
Thank you.